whereby services submit evidence against those set of standards, and then they're accredited for a period of 3 years. And then in the last 7 years, we had government support to develop lifelong links, which is using family group conferencing alongside very intensive search strategies, a lot of work that we drew from family finding in the US, but combining it with FGCs to work to build a network of support for young people in the care system. And that's work that was evaluated by the University of Oxford. I'll say a little bit more about that later on. So these are our 7 standards. So our accreditation framework has been, as I say, has been running for about 11 years now. It's a peer-led process. These are the standards that we arrived at through our consultation with the network. And under each of those standards, there's a series of measures. So in total, about 43 separate measures around FGC practice. And the fundamental purpose of this really is about maintaining model fidelity, because I think, and I'm sure other people have had that same experience, that there are lots of potential challenges to model fidelity, and we've seen that within practice in the UK, and the need to really properly ensure that the process is properly followed. So I'm just going to give a little bit of information. There was some work that was done by CASCADE at Cardiff University around the uptake of how the degree of use of FGCs across England. So the Family Voice study, the first part of a 4-stage research program, was to do a survey with family rights group, contacting local authorities around FGC use, and that demonstrated, I think what we knew already really was that around about 80% of services of local authorities have got FGC services. That's been a figure that certainly in England, that 82% has been a figure that's been consistent now probably for about 7 or 8 years. If you go back to 2003, Louise Brown, who's an academic at Bath University, did a similar survey, and at that point it was about 50%. So there's been an incremental growth, but it's remained relatively fixed around 80%. For, as I say, for about 7 or 8 years. About 2/3 of those services are what we call in-house services, so run within the local authority, and about 1/3 are provided by independent providers. And that has been a shift as well since Louise Brown's research. At that point, it was about 50-50. So it's now most services are in-house. The same survey found that about 60%, I think it was 59% of services said they had grown in the last 3 years. So there's a continuing expansion of services. The kind of areas of work that family group conferencing is involved in the UK, increasingly there's a developing network around adult social care. So perhaps 5 or 6 local authorities doing FGCs in relation to adult decision making, whether it's mental health planning or care for the elderly. So that's a kind of definitely a growth area in the UK. Small numbers of services using FGCs in relation to community-based challenges, particularly around locality difficulties like local estates, perhaps gang-related issues. Certainly 1 or 2 authorities at Islington in London doing some really remarkable work within some of the estates in the borough in relation to gang-related activities. Youth justice services, much less developed in the UK than, for example, in New Zealand. I know in New Zealand, about half of FGCs are youth justice family group conferences. It's much less developed in the UK. But there are 1 or 2 very well-established services. And I've referenced a project in Leeds in the north of England that is doing family group conferencing for young people in prison, and also in relation to young people involved in burglary of houses, and has done some very interesting work, and has used the police data to then follow up on what's happened for those young people subsequent to their FGC. And then, as I say, we've been involved in developing lifelong links. I'll have a couple of slides about lifelong links a little bit later. Moving on. Oh, there we are. Yeah, so just a quick slide on lifelong links. So we were funded by the government to introduce lifelong links initially in 12 local authorities. It was part of a research project by the University of Oxford, and that reported in last year, and the evaluation reports are on Family Rights Group website. I think that the data on this, so the figures now are about 2,500 young people have had lifelong links, and on average, the evidence is demonstrating that they begin with a support network of on average of about 7 people, and at the conclusion of the work, that has grown to on average about 26 people available to young people as a support network for them as they move through the care system in England and Scotland, and into the adulthood. Currently working with 32 local authorities using lifelong links. This is just some of the key findings from the evaluation of lifelong links. So the young people were measured on with the strength and difficulties questionnaire at the beginning of at the point they were referred to lifelong links, and then subsequently that measure was used again 3 years after the introduction of lifelong links, and they'd moved from in the top tier of concern in relation to how the emotional well-being was measured into the normal range at the point of 3 years after the involvement in lifelong links. Placement stability, those young people that had lifelong links were much less likely to have changed placement in that period of time, that 3 years. And there was a cost benefit analysis of the programme, which demonstrated a very small saving of £1.02 against every pound that was spent. We've subsequently had a piece of research following up those young people into adulthood, and there was a 10% reduction in homelessness amongst those young people that had lifelong links compared with the group that didn't have lifelong links. So, you know, the long-term potential benefits of using an FGC to build a support network for young people in the care system, I think has got clear benefits that will go on into their adulthood. I'm going to just quickly 2 more slides. One is that our government initiated a review of our child welfare system, which reported in May last year. And there were kind of 2 key messages from that report. One was about recommending that family group conferencing, family group decision making should be a mandatory offer to families before they're likely to enter into the legal system. And that was a recommendation from that report. And secondly, there was a recommendation that all young people should have access to a program similar to or lifelong links by 2024, that all young people in the care system should have access to that. And the government's response to that report was to set itself a target in relation to access to a service like lifelong links. They've set a target of every young people in the care system to have access to such a service by 2027, and they provided funding of £30 million in the next 2 years to increase the number of authorities that are able to offer that service. And also, very significantly, they made a commitment that to test out family group conferencing as a pathway for families in 12 areas, and a sort of further package of developing what they've called family network support packages, so resourcing of services for families that result from that kind of work to begin in the summer of this year. So some positive progress, particularly in relation to lifelong links. I think what I've tried to demonstrate is that there's been a growth over that 30 years of development, and I think the 2 research projects that you're going to hear about next are kind of evidence of that and the different ways that FGCs can be used in relation to decision making in the UK. So I'm going to stop sharing. And if anybody's got any questions, we're going to have a little bit of time for questions at the end. If people want to flag anything, but we will have some space at the end of the presentations as well. So if you have any questions, just put them into the chat. If not, we'll move on to Lorna. Are you okay to share the Lorna?
Yep. I was just waiting to see if anyone had any questions there. It always takes me a little while when I've got to type something out. So, right, I'm just gonna get the presentation up. So this is my second presentation at this conference, and this is a different system from the one I used for my first presentation. So I'm all thrown off course. So here we go. Can everyone see that? Is that okay?
Yep, that's good.
Perfect. Okay, so thank you, Sean, for that introduction to kind of what's going on in the family group conferencing world in the UK. And as Sean mentioned, I'm going to talk a little bit about a project that I've been working on over the last couple of years, and that Helen, who's also here, has been supporting on. So that's called the Safeguarding Family Group Conference Study. And as you can see, we're quite a big team here, so spread across Cardiff University and Exeter University. So first question, what is a Safeguarding Family Group Conference? So as Sean's kind of talked about, the family group conference model is a set model with agreed standards and kind of is applied in different settings, but with the same kind of core principles underpinning it. The work that I'm doing now comes from a model that was designed by 3 local authorities in London in kind of 2018, 2019, where they were thinking about how they could improve the way that they worked with families to enable them to take part in really important decisions around kind of child welfare and safeguarding concerns. So they kind of decided, kind of with their model, rather than inventing something new, a family group conference could offer a mechanism for working differently with families who ordinarily would have what's called in the UK an initial child protection conference. So I know there's a lot of people here from various places across the globe. So really an initial child protection conference is that first kind of multidisciplinary meeting where services come together to share that they have concerns about a child and think about what the next steps might be in terms of, you know, often escalating intervention in family life. There has been quite a lot of research that has explored kind of families' experiences of these initial child protection conferences, and quite often they're found to be quite shaming and actually quite, they don't necessarily create the environment that allows a family to then say what it is that they need in order to make improvements in their lives. So these local authorities kind of introduced an offer of a family group conference instead of this multidisciplinary meeting that usually happens. So in the process as it exists, the ordinary pathway is always to go to this initial child protection conference. Quite often, actually, within these local authorities, they were using family group conferences for families where there were these safeguarding concerns. So they would have an initial child protection conference and then make a referral for a family group conference. But quite often at that point, families turned them down because they'd already gone through this process and there was already a plan that had been determined by professionals. So they felt that actually, if we were truly going to hand over decision-making power to families, maybe we could do this family-led meeting as an alternative rather than, you know, alongside a professionally led process. So the model of the FGC, as I say, is exactly the same and follows, you know, those standards that Sean really clearly set out before. But importantly, particularly where there are safeguarding concerns with families, that there might be slightly different processes around that family group conference. So, for example, in some local authorities, they wanted to do an FGC a bit quicker than they might do in another part of the system because the concerns were quite high for this child. So they want to make sure that there is still oversight and there is still work being carried out to ensure that the child is safe and being protected. So The idea, so we did an initial pilot study with these 3 local authorities, so back in 2020, to think about kind of what was it that was kind of changing within their system. And we were quite different to the study that Ellie will talk about after this. We weren't really thinking about numbers. We were very much thinking about the theory behind what these local authorities were trying to do. So why is it that they were reaching for a family group conference to kind of address this kind of point in the system, and what problems was it trying to overcome? So we spoke with practitioners, we spoke with families, we observed some of these new meetings as well. And practitioners talked about them feeling like there was a reduction of shame and blame in the meetings. So the focus of the meeting, instead of information sharing and making sure everything was kind of on paper and everyone kind of felt comfortable, knowing that all the concerns were out in the open, it was much more about actually what do we want to do to move forward from this. Parents were participating in more decisions about how to keep their child safe, and the wider support network were actually feeling empowered to kind of come in and kind of take part. And quite often the families that took part in this pathway had previously been down, the more kind of professionally led route. So they'd been in kind of child protection before, and then this was a different way of working for them. Practitioners said that they felt that the child's voice was more central to decision making. Obviously, this was a very small pilot study, and we weren't measuring that. And I guess for me as well, it's always important to think about what children think. So we did observe some meetings where children were there and they were kind of taking the lead with the meeting, which is very different to what usually happens in a child protection conference. But yeah, there was the practitioners really felt that children were more involved in these meetings. We also thought about how practitioners were feeling, because it's quite difficult for practitioners to move away from the process as it is. So they talked about that actually it helped them feel that the child was safer, seeing this network around them and seeing that kind of strength that the network brought, because quite often previously they would only really see family life from the perspective of just the parents, and they weren't aware of this other group of people who were around, who were looking out for the child. But they also talked about how difficult it is to make a change and kind of take that leap, and wanting to see how it happens and see somewhere else where it's happened well, and hear about kind of families and what difference it's made in their lives. So the project that I'm working on now is looking at how to take what was learned in those 3 local authorities and move that to new settings. So we are working with different local authorities in different areas. So again, some in London, but some in the Southwest as well in England, to think about where local authorities have different practice models, have different resources, have different populations that they're working with, and also different concerns that they want to address within their own setting. How might this model work for them? So I won't talk too much about kind of our methodology, but I can share some links, but we're using what's called a kind of realist evaluation. So thinking really not just about kind of, does this work to achieve, set outcomes, but what outcomes might it lead to, and why might it work? Why might it work for different people? And also kind of, does it work differently for different groups? So for example, does this seem to help, particularly where the concern about the child is actually from outside of the family network, rather than within the family home? Or is this something that's particularly helpful for pregnant mothers who are involved with child protection for the first time? So we're kind of looking to see how it might operate differently in different areas. So our key kind of research questions are really looking at implementation. How do we actually get to the point of creating this change within local authorities? What is it that places need to feel like they can introduce a model like family group conferencing in this really, really tricky work of child protection? What is it that they need in order to shift not just their mindset, but also their processes? And what are some of the barriers to doing that, and how can we overcome them? what outcomes are of interest to families and professionals. So again, Ellie will talk a little bit about some of those outcomes that we've seen working from family group conferencing, but also, you know, we really want to unpick what is it like from a family's perspective and from practitioners' perspectives that could change by working differently at this point. And then also, you know, that question of kind of which families, which circumstances can lead to achieving those outcomes. And I guess for the local authorities that are taking part, and I saw that we had someone from one of our local authorities that are taking part who came in and had to leave before, but, you know, so they all came with different ideas of what they want to achieve with this change. And actually, since we've been working on this project, we've had quite a lot of other local authorities who are now looking at trying to do something similar, including in Wales as well, where we haven't started this work, but it's coming. So, you know, on one hand, actually, it came from a real recognition that they wanted to work differently with families. So the process as it is at the minute, with that route to an initial child protection conference, there's a real acknowledgement from within services that, you know, sometimes that doesn't make any sense. You know, it doesn't make any sense to go down this route where we bring more professionals in and really have more oversight of a family when, you know, that those concerns, those safeguarding concerns, are potentially out of the control of that family, or they've been down that route lots of times before, but it's not actually created meaningful change for them. Or, you know, there's an acknowledgement that there is this wide network of people around the family, but they're not being engaged in this child protection process. There's also that desire, which, you know, is really where this project came from, to find a model that fits better with practice models that put family at the heart of the work that they're doing. So, you know, things like restorative practice, systemic practice, that really is thinking about the family's perspective. Some of the processes as they are, you know, don't fit comfortably with practitioners who are trained in this way. And then there is also, you know, this kind of focus on the need to reduce child protection rates and kind of children then coming into care, and to shift a focus on early intervention and prevention, and really engaging, you know, the family earlier on in these different ways of working, rather than kind of waiting until later on. And some of the work that I do outside of this project is around kinship care, where children then go to live with their wider network, and quite often what they say is, if only I'd known sooner, I could have been involved and I could have helped it not get to this point. So kind of positioning this work a little bit earlier on, you know, gives that opportunity for the wider network to come in at an earlier stage and provide some of those solutions. So we're kind of coming to the end of work package 1 now, starting kind of our work package 3, which is families kind of coming through the process. But I just thought it's probably best to talk about work package 1 now, and then hopefully next year we'll come back to this conference and I'll tell you about the outcomes as well. So we've taken a really qualitative approach to understanding the settings that this model is being implemented in. So we're really thinking about what is it within local authorities that enables them to create this change, and also what are the barriers there, and how can we help provide targeted support. So quite often, and I've worked in children's social care research now for starting to get on to close to a decade, and quite often we see interventions, new ideas kind of come in and then just fall by the wayside, or, you know, people want something to work, but for some reason it just doesn't gain traction there, or it happens for a couple of years and then it drifts off. So, you know, we really wanted to think about, okay, well, what are the practical things that local authorities need in place to be able to create this change and do this work? So we've used this framework, I won't go into it too much, but called CIFA, which is the Consolidated Framework for Implementation Research. And what that really does is it draws together findings from across different areas, so health, adult social care, children's social care, and different environments. And that really maps out kind of what are the things that usually influence implementation within systems. And so then we've done interviews within our sites to think about, are these things, how are these things playing out in a children's social care setting, and particularly in a child protection setting? So what is going on that help or hinder intervention and innovation. I can share this in a little bit more detail afterwards, but I just wanted to give like a little bit of a flavor of some of the things that are coming out. So in particular, this idea of intervention characteristics. So people need to believe that the thing that you're trying to change is actually better. And I know that sounds really basic, but actually, quite often, practitioners, the ones that are on the front line who are going to be delivering this change, are just told that this is the change that's happening. They're not involved in a process of really kind of thinking about, well, what is this addressing? How is this different from my current work? What will it lead to that will help improve my job and the families' lives that I work with? And then on the other side of that, there's really practical things. So one of the huge barriers that local authorities have found is having an IT system that's flexible enough to include a new process. So, we have quite a lot of quite rigid IT systems, which are really important in terms of information sharing with partner agencies and ensuring that everyone is on the same page when it comes to safeguarding children. But if you want to introduce something new, that change is very, very difficult to do, particularly across multi-agencies. So, a huge barrier is actually, how do you align innovation with other things that are happening across the local authority? So how do you time it so that you introduce this new process at the same time as you're updating your IT system, and actually plan and map out a program of innovation, which I think is something that is still quite a struggle to do within the children's social care arena in the UK. And other things that kind of came out, which could be kind of barriers to change in child protection, was, probably not going to be a surprise to people in this session, but risk, that real worry about, if we do something differently, is this going to be riskier for children? But also, what impact is that going to have on me if something goes wrong, me as an individual practitioner and us as a local authority? There's a huge amount of worry and anxiety around kind of doing things differently with families, and it can be a real barrier to introducing this new way of working. We also saw quite contradictory things about local authority sizes. So, some local authorities said, well, I think we're too small to do this, we don't have the resources, whereas others said, we're too big, we wouldn't even know where to start. So it's thinking about how we work alongside local authorities to ensure that interventions kind of fit what they've got and make the most of what they've got. And then there's a huge impact of, in the UK, inspections. So Ofsted's coming. We need to wait. We can't make any changes because we need to know if they're happy with us, if they're not happy with us, what rating we're going to get. So that had quite a big impact as well. So I'm going to end on this slide here and hand over to Ellie. So Lisa Mergel Hogan, who's instrumental in bringing together this whole conference. And so she said, kind of back in 2004, are entrenched and powerful systems ready for a practice model that's as empowering as family group conferencing? And that's really what our study is looking at. So the model itself of a family group conference really challenges the heart of what child and family social work is in the UK, or what it's become over the last few decades, and trying to say, can we shift our focus when we're thinking about really key decision making, not just to bring families into that arena, but to let them lead it, is a real challenge to the heart of children's social care. And our findings so far have kind of shown that. They've really shown that, on paper, you could say, well, you're replacing one meeting with another type of meeting. What's so innovative there? But actually what family group conferencing does is really challenge, who people think are the safety network for a child, where's the risk, who's the resource for this child, and shifting that from assuming that has to be held by agencies and professionals, and acknowledging that actually it's families and it's that family network that are going to hold that child in mind, that throughout their whole lives. So they are the ones that are integral to offering that support. So that's me. We've got a website and all this type of stuff, so you can get in touch, but I guess we've got a couple of quick minutes if there's any quick questions now. And if not, we can come back together at the end for more of a discussion. I don't know, Helen, I could see a couple of things flash up, but oh, I don't know. No.
We have a nice comment from Melissa about, yeah, pushing up against assumptions about the safety net families can provide. So I think it's quoting your last remarks.
Perfect. Well, I'm gonna leave it there if we don't have any specific questions, and things like methodology and what we're doing now, I can share some links in the chat as well if people want to read a little bit more. Ellie, if you're happy, I will pass over to you.
Thank you, Lorna. That was great. I learned lots of things. So that's always nice when you come to these things to present and you leave with more information than you had. I'm going to start with the link just so that if people want to sort of follow along at home, and not only to the presentation, but to sort of some of the more detailed report findings, then it's all on the Foundation's website. And now I'm going to share the screen, which means I won't be able to see any of you. But I'm going to assume that you can see and hear me. Can somebody let me know that they can see that?
Yes, we can see you.
That's good. Yep.
Super, fab. Thank you so much. It's always reassuring. So just by a little way of introduction to myself and Foundations and what the What Works Centre does. I know not every country or everyone will know what What Works Centre is. So Foundations is focused on evidence generation. So this means conducting trials, doing evidence synthesis, supporting the research pipeline. But then also a really big part of our work is championing that evidence use. So via influencing national and local government, or supporting the sector and other of our partners to push forward when we do find things work. So that's where I work in the impact team, focused on policy influencing. So when we find something works, how do we get people to do it? That's also my time to add a caveat here, which is that I'm not a researcher. So I'll do my absolute best to answer any methodological questions anybody has. But if I can't, I'll put you in touch with somebody who can. It's really great to be here with such a diverse panel as well today, and different people presenting from different perspectives. I think that's been the real benefit of family group conferencing over the last couple of years. It's really galvanised different people across the sector, the third sector, local authorities and researchers. So Foundations brings together the expertise of the Early Intervention Foundation and What Works for Children's Social Care. So we merged about a year ago. And I'm head of policy, and I'm here to talk to you today about the findings of our randomised control trial into family group conferencing. So some of you may have heard about it, and I'm going to try not to bore you with too much of the methodology today, and the full report and all of the details are there if somebody is particularly interested. The first thing to say is that this was the first ever randomised control trial of FGCs in England. So as sort of Sean set out in his presentation, the interest in FGCs has been growing over time. More and more local authorities have started to use them. We think about 80% of them are doing so now. And we wanted to test their impact. And we looked at this particularly at the point of pre-proceedings. So for anybody who's not familiar with the sort of UK children's social care context, pre-proceedings is, and there's a good definition on the right-hand side of this, is the point at which local authorities write to families and basically say, if we don't see improvements or see a reduction in risk for this child, we are going to instigate care proceedings via the court process to have the children removed. So it's a real make or break point for families. The evaluation used the family rights group model, and we had the third sector provider Daybreak support local authorities with the delivery of their family group conferences. We also did an IP alongside the randomised control trial, which really tried to get under the skin of what was happening in practice, how families felt about it, and how practitioners were using this new process in new areas. It was huge. It involved over 2,500 children, approximately 1,500 families in 21 local authorities in England. For anybody who wants a bit of context, there are currently 153 local authorities. So this was relatively big as trials that we've undertaken went. You'll notice from the dates at the bottom of the screen, this happened during COVID. So lots of things changed about the implementation of FGCs, including lots of them being used online. So if anybody's interested in thinking about hybrid use of FGCs or online use of them, there's quite a lot of detail in the IPE that looks at how people experienced that. No surprise to anyone, poor internet connection is mentioned a lot, and we published it earlier this year in sort of June 2023. As Lorna alluded to, we were really looking at the effect that family group conferencing had on keeping families together, so safely reducing the need for a child to enter the formal children's social care system and become what is in the UK referred to as a looked after child. So the primary research question here was exploring the effect that referring a family for family group conferencing at pre-proceeding stage in comparison to sort of the usual services that would be provided to that family has on whether that child enters care. And we looked at that over time at 6, 12 and 18 months, but the particular time we were interested in here was 12. There are a bunch of secondary research questions as well. And again, if people have got specific questions about those, I'll do my best to answer it. It's worth noting that on the sort of perceived inclusiveness, so the researchers wanted to ask parents how they felt about the process and whether it felt like they were included more than they otherwise would have been. They had a really low response rate on that question and therefore didn't find anything on that. Here's what I think is the really exciting bit, which is the findings. And I think this adds something to the debate and the conversation that's been happening over sort of the last sort of 10, 20 years in the UK and internationally, which is that lots of people for a very long time have been making a rights-based argument about family group conferencing, about the way it works with families in different ways, about the obligation to give families and parents an opportunity to solve the problems themselves, and all of those arguments are exceptionally important, and we're really pleased to be working with partners who make them. What we also know that is important is having evidence of what works so that it actually improves child outcomes, and that it's a good use of good value for money, good use of resources, and that it's possible to do. So that's where the IPE gets in, which is, I think, as Lorna talked about, even if you've got a good idea, even if you find something works, trying to get people to change their behaviour is really, really hard. So the key finding here is that children whose families were referred for a family group conference were less likely to go into care 12 months after pre-proceedings. And this was quite a big shift, and it was statistically significant. So just over a third of children whose families were referred to an FGC were taken to care, whereas compared to about almost half of children who were not. We think this means we can be confident in saying that family group conferencing is effective at keeping families together. And we also found that even when children do go into care, or a child does go into care, they were in care for fewer days, which we think is also important for thinking about child outcomes. The other thing we found is that FGC was a cost-effective intervention, which I think lots of people in the sector and practitioners have been saying for a very long time. But it was really great to be able to have these numbers on paper, to be able to make this case, particularly to national government, but also to local authorities directly, given the context of sort of in the UK of very, very tough financial and resource constraints in local areas. So my job and my real passion is thinking about, once we know all of these things and we've got this really good, very robust study that says that this works, is what do we want to do with it now, and how do we make that happen in practice? So on the left-hand side, we've got what we think is a really good value for money case to be made to national government and in local areas around the impact the family group conferences could have, which is that it would mean fewer children go into care, and it would save the public purse £150 million over 2 years. We know that it's not always comfortable to be making that case, and it's not necessarily the one we would like to be able to be making to change hearts and minds, but we also know that it is pretty effective. So it was really great to be able to make this so clearly. We also think that more local areas should be using family group conferencing. We think that we are nearly there. The CASCADE survey and others say it's about 80%, and there's just a bit of work to do to both support local areas, but also to get that buy-in from anybody who hasn't yet heard about it or doesn't yet believe in sort of the power and importance of family group conferencing. We also found, and Sean talked a bit about this as well as Lorna, about fidelity to the model. So the IP was quite clear about, generally speaking, local authorities were very good at sticking to the family rights group standards, and the support of Daybreak was really useful in helping them do that. And we know that we shouldn't be watering down what a family group conference is if we want them to be effective. So that's why I'm really interested in the work that Lorna's doing to think about actually how you get people to change behaviour and the sort of barriers and enablers of doing that. The final thing to say here is about what we want to see sort of nationally in terms of policy change is around the support package that we think families need to enable them to and empower them to sustain those changes. Our study found that at 18 months, the finding was no longer statistically significant. And this could just be because the sample size reduced quite a lot at 18 months, but it also could be that it's actually quite hard to sustain change in families, and that more support and more effective services being wrapped around the family at the point of sort of the family group conference could be a really helpful enabler there. So the UK government is committed to testing family network support plans, which following a family group conference would mean the local authorities resource that plan fully to sort of enable that sort of longer term change in families to improve those outcomes for children and young people. The things we're focused on now in terms of next steps and trying to push this out into the ether of English national government is firstly on the kinship strategy. So I think Lorna and Sean actually both talked about the links between family group conferencing and kinship here. So the UK government is committed to publishing a kinship strategy by the end of this year. And we're expecting them to reference family group conferencing, reference the evidence base of the trial, and also commit to taking forward steps that will enable more local authorities to be delivering family group conferencing there. We also recently had an event with our new minister, our new Children and Families Minister, to discuss the power of family group conferencing and to sort of bring the sector together to sort of galvanise change around this off of the back of the study and the work of FRG and Exeter and other great people in this space. Going forward, we're really keen to work with those local authorities not currently delivering it or expanding the volume that's offered to families. And we know that there's really big variation. Some local areas are doing hundreds of thousands a year, and others are doing in the sort of 1, 2 to low tens. And we think this is really important, that all families are meaningfully offered the opportunity to have a family group conference at pre-proceeding stage, because we think there is like very strong evidence here that on balance, that's likely to improve their outcomes, likely to improve the outcomes of the child and the family as a whole. So I think this is really exciting, and we're going to be doing some work as an organisation to push this forward in both the sort of national government influencing strategy via the kinship strategy, and looking forward as well, sort of the next government, as well as working directly with local areas to support them in this. I wouldn't be a good research organisation if I didn't also point out the need for further research. So this is my final slide here, which is just to say we don't know everything. The trial was really promising and it does tell us some things, but there are lots of other things that we would like to explore that we think other sort of colleagues in the sector are doing a good job of exploring as well. So in particular, this is sort of the use of FGCs at different points in the children's social care system. So Lorna's work looking at child protection conferences is a great example of this. And we think there's also quite a lot of appetite to looking even earlier in the system at sort of that early help, family help stage when problems start to emerge, to see whether or not using family group conferences there can help keep children safe and keep families supported. Because our trial was done during COVID as well, there's a really big interest in here to think about the impact of hybrid versus online versus in-person mechanisms of delivery of FGCs and how we can utilise technology here. But we want to understand a bit more about what the likely impact of doing that will be. And the final thing to say is that there's definitely more work to do here to understand the actual and perceived level of involvement in the process from children and wider families. Really interestingly, that our implementation and process evaluation didn't find that families necessarily always found this to be an empowering process. Some families described FGCs as just being another meeting or another service on top of all the other things that were happening around that child and that family during a very difficult time. And we'd really like to do some more qualitative work with families to really understand their experience of being offered and then receiving a family group conference, particularly taking an EDIE lens, so looking at the experiences of minoritized families in that as well. That was a real whistle-stop tour through what's quite a complex trial. So I'm going to stop sharing my screen so I can see you all again. I think have I done that? Yeah, you can see me again. Yeah, great. Are there any questions? I think I'm going to hand back to Sean, who might take us through a bit of a discussion.
Any questions for Ellie, for Lorna, or even for me? Any questions, thoughts, reflections? Perhaps thinking about the relevance of these two research studies in relation to your own practice where you are?
I think people can just come off mute and join in the conversation as well, can't they? If you're
Absolutely,
not as keen on typing like me.
Yeah. I mean, so the one thought I had from your presentation, Lorna, I remember looking at the numbers of children who were subject to child protection plans, so who had reached that kind of threshold of engagement with services that were still living at home, and we have government figures for that, and it was something like 96%, 97%, and it was the same figure going back over years and years. So the numbers of children that are subject to child protection investigation and child protection plans is, 9 out of 10 children are within their family environments. It's the family that is responsible for their safety and for their day-to-day care. So if we're not effectively engaging that network, then there's a question then about how effective any kind of safeguarding practice is going to be if you're not bringing that network to the table. So I think it's really, really key that we do that. I think somebody put a question in the chat.
Yeah, so
Yes.
Melissa's asking about methods for considering family thoughts and perspectives. And I guess, so Ellie, you raised at the end that you'd be interested in exploring that. So I don't know if you want to talk about that, and I could talk a little bit from our study as well.
That would be great. So again, caveat, not a researcher, so I wouldn't be involved actually in the design of it. But what we are thinking about is the fact that the IPE was very focused on fidelity and how the process was run. And actually what we'd really benefit from is some more qualitative, probably quite in-depth work with families who have either been offered an FGC but turned it down, and getting under the skin of why that was and what they thought about it and how that conversation went, but then also exploring the experiences there. So yeah, it would be a qualitative study examining that. But yeah, Lorna, you'll have a more technical answer than I will.
Hopefully not too technical. Yeah, so interestingly, so in our study, we're really going for depth as opposed to breadth. So we are looking at in case study sites, a smaller section of those local authorities that are trying this approach. We have what's called like a researcher in residence. So there'll be a researcher who's embedded within across the FGC, the family group conferencing, and the safeguarding team, who then, when a family is considered like for a referral for a family group conference, we can do a few different things. So we can go along and with their consent, observe the conversation where they're offered the family group conference. We can also, if they want us to, come along to the family group conference and observe it. And that will be kind of not audio recorded or anything, but using an observation framework. We can then also interview the family, so anyone in the family, including any children, and we can do that kind of in a very, ordinary qualitative kind of semi-structured interview way, or also in a kind of creative way with younger children. So we're trying to be as led by the participants as possible. So we've got lots of different ways they can take part. They can also send us written feedback, things like that. So we're not looking for we don't need like a certain return rate or anything like that. We're really trying to do different things so that people can engage as much as possible. And what we're also doing is going along to different advisory boards and groups of people who have experience, so that they can take part but not necessarily have to talk about their own experience. So there's a really lovely group at Camden Local Authority. You might have seen some presentations from them as part of this conference, but they have a family advisory board. So they are parents who have experience of going through child protection, but also a family group conferencing. So we'll go and we meet with them and kind of talk through kind of how it feels for them to do a family group conference, and what offering a family group conference instead of the child protection process kind of will feel like for them. And then they are working as kind of advocates for people going through that process. So yeah, we're trying to capture things in lots of different ways. So hopefully that gives you a flavour, Melissa, of the things we'll be doing. I don't see any other questions. And I was just going to say, Sean, I am just to come back to your kind of reflection right at the start of the questions there. I completely agree with you about what is a safeguarding process that doesn't include the wider family anyway. And one of the things that's really, really struck me doing this work is that a lot of practitioners will say, oh, well, where is the evidence that this works? And I guess my challenge back is always, well, where is the evidence that the current process works? Having a meeting doesn't in and of itself make a child safer. So I think there's a big gap in reflection around processes and what they're trying to achieve. And arguably quite often what a process-driven system achieves is a way of managing professional anxiety. And I would argue that that's not good enough for our children's social care service. So yeah, just to come back to that, I think it'll take a little while to change that thinking, but I completely agree. There is no safeguarding without bringing in the people that are important to the child.
Absolutely. And I think if you look at who participates in those professionally led meetings, I think we do a lot of work as well at comparing family group conferencing with family network meetings, and the kind of signs of safety model of family network meetings. And I know there's some research around the practice framework around family network meetings, which doesn't have a clear kind of protocol or kind of practice guidance around engaging wider networks. And the result is that the people that come to family network meetings are largely often just the parents, and often just the mother. So as a mechanism for engaging wider network, I don't think there is anything that is as effective as family group conferencing.
We've got two questions in the final minute.
Yeah. Adelaide, and then was it Denise?
Yeah.
We'll go Adelaide first, and then Denise.
Yeah. I just want to say that I'm a special guardian and kinship carer, and before my child came to me, I was involved in a family group conference in which I was identified. I offered to support the bed parents to keep their child at home, but after various interventions and other things, it became clear that they could not have their child at home. So I was asked to come forward and apply to have him as a special guardian. So which I did. And when I was doing that, I didn't realize that in a way I was safeguarding the child, because I was there most of the time. I was going to their house. I didn't live in London, but I was traveling to London to make sure that the child is being fed, and the child was coming to me for some weekends away from their parents, so that the parents can go about and do whatever they wanted to do in the first place without taking him along. And listening to your presentation makes me feel like very useful that I helped the child in more ways than I think I have. And I've had a child for 12 years now, and I'm still fighting for him, and I'm still there for him all the time. So it's good to know. And I'm part of family rights group, by the way. I'm one of the kinship panel members, and I've been there from the very beginning.
Oh, thanks, Adelaide. It's really positive to hear that kind of long-term outcome for the child you're looking after, and it stands to reason if you share that understanding about any concern that there is about a child's welfare, and you share it amongst those that are most closely involved in that child's life, then there is that potential to draw on that natural expression of concern and interest that you will have as a family member in your child, and for that to be over such a long period of time, that you're not going to get that from professionals. Their relationship to a child is not going to be like that. It's going to be a different kind of relationship. So that's really positive, Adelaide. Thank you. Now, Denise, I don't know whether you still wanted to come in.
Well, there's not much time left. I'm from Nova Scotia, Canada. I just wanted to say that our Indigenous agency here, Mi'kmaq Family and Children's Services, has been using family group conferencing for quite a long time. They incorporate Circle as part of that, and it's been really effective. And the outcome has been, in their particular agency, has been a significant reduction in the number of children in care. So if you want to look at evidence and outcomes, like that's a good way to look at it. And we are trying to start incorporating that on a more frequent basis in the work that we are doing for that reason. And to engage families earlier on, bring family, community, and increase people's circle of support around them when they're involved in child protection agencies. So I just wanted to throw that out there. Like I think everybody's on the same page and moving in that same direction. Yeah,
absolutely. That's really, really good to hear. And there's so much international research that is coming up with the same key messages as well. And I think, Denise, that's another example of that. So really, really welcome to hear that. Has anybody else got any other questions or thoughts? Sorry.
Yes,
Yeah.
I might have a question from Thomas from the chat. So the question is, have you got any results on how children's wishes are or can be focused?
Is there any,
children's wishes? Any results on how children's wishes are or can be focused?
Okay, I know there's been some really interesting Norwegian research around children's views of FGCs. I don't immediately have the reference, but I remember because we've used some of the findings in some of our training, and I think the general view about children's participation is it's very easy for children to be marginalized even within FGCs, even where they're kind of central to the process. It still is quite easy for them to become marginalized and adults' perspectives to kind of come to the fore. And there's a couple of messages from that research. One was that children often didn't recognize information about themselves in the referrer, the information givers, information to the first stage. They felt a bit invisible. They didn't feel like it reflected them. Another message I remember was that if there was conflict in the first stage, children would report that it would carry through into the private family time. That was another message. And I suppose the third bit was that what they valued was relationships. They valued seeing their family coming together. They were less interested, and their comments reflected less the actual content of decision making. It was more about the experience of seeing family come together. And that, I think all of that makes sense. But I think we need to improve our practice around engaging children. I think the lifelong links work has been really interesting because it really, really absolutely puts the child in the driving seat in exploring the historical networks and really beginning to kind of do the detective work about examining potential relationships, previous relationships, and to do that, you have to really absolutely have the child central. And some of the strategies, mobility mapping and using genograms. We've developed what we call our social connections tool, which is an online tool that you can use with a young person to explore relationships. So we've developed all these strategies within Lifelong Links that I think really do put the child at the center of things. But I think there's definitely work to be done around how we achieve that. I did put the link to FRG in the chat. There's a massive amount of resources, particularly around Lifelong Links, and we've got lots of media material, children's description of their experience on the website, and I would really recommend people have a look at that. The other thing I was just going to post, I'll post it now, is that we were talking earlier about families' views about outcomes, what families think about FGCs, and I just wanted to reference Mary Mitchell's work at Edinburgh University, which I think is really, really fundamentally, she explored what families and social workers thought about their experience of family group conferences. I think she interviewed participants in 11 FGCs, and one of the things she found was that families' expectations, what they wanted from the process, was different from what social workers wanted, and the kind of description of process was different. So they're approaching it with different expectations, and the kind of frame that Mary Mitchell used to explore it all was this notion of recognition theory, about what the process of the FGC does is really make families feel that they are properly being recognized, properly being acknowledged, and their emotional involvement in their children's lives, and their status and their rights are properly acknowledged within the process. And that doesn't happen in the same way in other professionally led meetings. So I think it's really interesting looking at her work and how she describes that process. And there's a really interesting media clip from somebody called Azaria, who's a young woman who was a heavy heroin user in Scotland, and who had an FGC. She became pregnant, had an FGC, which was absolutely transformative for her. And she describes that experience of the process now, how very different it was from her engagement with services that had little faith in her potential for being a parent. So there's some really useful resources. If you just research FGC, Mary Mitchell recognition theory, you'll find they did a whole day around the theory with practitioners and families. It's really interesting.
I've put a link to that paper that you wrote there as well.
Brilliant.
Yeah, thank you very much. That was very helpful, because this is really a question that we are focusing now at our German language speaking FGC meeting, which will occur in a fortnight, about right after the European meeting. And I found during several sessions here that focusing the child's interest is getting more and more important as we find out. We found out how to do FGCs, how to implement FGCs, how to repair families or help them repair themselves. But in the end, who does hear the children? Has anybody heard what they want, what their urgent needs are? And we have the idea, we forgot a bit about this, and so we're missing a chance, sorry, my English is passing out for a moment. Hang on. The coordinators have got a very good chance to change their position from being the white elephant in the room to being the fairy that is opening the possibility to share wishes and to get those wishes, those needs met. And this is what I was thinking of, because there will be a workshop in a fortnight, and I've been asked to hold this workshop, and I was thinking, well, how should I start? How do you find this idea of the fairy instead of elephant? Is that a good approach, or have you got any ideas?
Any thoughts people want to come back on that?
I was going to say, I think we're basically out of time, but Thomas, if you want to get in touch, I can send you my email address. But I've heard some really beautiful practice from FGC coordinators working with children and how they can really be creative in the work that they do, which, you know, there's sometimes a lot more limitations to do that in statutory social work. But, you know, I heard a beautiful example of a child-led FGC conference where they basically ran it like a birthday party. So, you know, the child kind of designed the invitations,
Good
picked the
idea,
food,
yeah.
had a cake, had balloons. And, you know, at the center of that was, you know, this is what I need. And this is what I'm asking, you know, from the people around me to kind of help keep me safe and help me thrive. So I think there's some beautiful examples of how it can be done, you know, really meaningful way. But I just don't think it isn't the focus, I think, of much research. So I think you're right. We need to hear more examples like that.
That's a great idea. I'm going to share that with people. That's a really good idea, having the child develop invitations and engage them in that way, especially older kids that, you know, who are reconnecting with family potentially, and who they, you know, we're looking at like longer term planning for them that have been in care for a period of time. Like, I think you could be really creative with that. That's a great idea.
Oh, excellent. Yeah. So I think something like that, like given that free opportunity to explore things differently and just think about it not just being another meeting, but, you know, it being an event, you know, and an opportunity to come together for children.
I think what we found with Life and Links is that because it's about kind of bringing together a kind of jigsaw of the child's experience, often you'll get family members come in that will bring mementos from that child's earlier life and sort of physical things that you can bring into the room, which is that's very, very profound, I think. You know, bringing in photographs from this is when you were a 2-year-old, that kind of stuff is really helpful, I think, really moving.
Thank you very much, Lorna. The system, the messaging system of the conference is not working at the moment, and so if we want to contact and message, we should change email addresses here on the chat.
Yeah, so I pop my email address in the chat there. Hopefully you can see it, Thomas.
Thank you very much. Yes. Mm-hmm.
Perfect. Yeah, so feel free to get in touch, and I'm happy to share some videos and thoughts and whatnot.
Yeah, thank you very much.
I think some people had to leave, haven't they? Yeah.
Okay. I'm conscious we have about a minute left. Has anybody got anything else to contribute before we do finish? Any thoughts? I think we're all very welcome. We're all very welcome to be contacted after the session if you need to get in touch with us. Very happy to do that. It's interesting to get people from different parts of the world. I think some of the messages and the learning is common to all of us, I think. And it's really useful to share that.
And I think
Okay.
I think you should all be very, very pleased with what you've got. If we look at what happens in my particular state in Australia, you'd be horrified. So it is so lovely to hear good practice happening.
Oh, I mean, that's lovely to hear, Kate. I would say that it's the same everywhere. You know, we are presenting what the good practice, but that doesn't mean that it doesn't feel like a struggle in some places as well.
Absolutely. Yeah.
Yeah, well done. Thank you.
Thank you, Kate. Okay, well, thank you, everybody, and good luck, and hope you enjoy the rest of the conference. Thank you.
Thank you
very much.
Good to see everyone.
Bye.
And hear from
Everyone.
everyone.
Thank you. Bye. Thank you.
Thank you. It's very inspiring. Thank you.
Good.
Yeah.
Oh, good. Thanks. I wasn't sure if we wanted to just wait for a second and
Yeah.
I would think we
it's just
can.
us.
I can stop the record first.
Yeah, I think everybody's gone, haven't they? Yeah.
Yes.